Sorry it's a little dark in here. It's still about 6:45 in the morning. I've decided to sit in on this little trending bonfire, COVID-19, share what I've managed to find so far. Not exactly promising, it's more repeating the same thing, but I do hope that you enjoy my performance. What do you say we brighten up this bonfire a little bit, huh? Not exactly a bonfire, but it's the best that I could do. All right, COVID-19 causes and symptoms. There are many handles for it, including coronavirus and SARS-CoV-2. Symptoms, which I researched from the CDC and WebMD by way of China for the medical website. The symptoms are stated as coughing, fever, shortness of breath, maybe loss of appetite, fatigue, body aches, and mucus buildup. All these symptoms are contradictory to well-known illnesses like the cold or the flu, but don't confuse the coronavirus with these because it's not a bacterial problem, and it's also allergy season, so don't confuse it with that either. The coronavirus was first discovered in animals in the early 20th century, specifically the 1930s and 1940s. Human cases were discovered in the 1960s. They wrote it off as a common cold. A few numerous variants of the coronavirus were discovered in the past 2 decades, including SARS and MERS, MERS. Short of a swab, slide, and a scope, there's no immediate reactive test for it. I mean, you can't take a sample, put it in a vial with a chemical, and shake it and turn the color. There's no test for that. If you treat it like a cold or a flu, you should be okay in a couple of weeks. If you isolate yourself, good hygiene, take your medicine, and it should be okay. You should be okay. However, for those with bronchial issues or weakened immune systems, in major cases, see your doctor. You might be tested, and if so, with the latest strain, you might wind up being put in the queue. Or if you're healthy enough, you could self-quarantine if you want for a couple of weeks. I've been following the numbers. The recorded mortality rate in the past month on average, death over the cases, is 5%. With the mentioned underlying cases, bad breathing or a bad immune system, your chances of death may increase. The number of deaths to separate with or without the underlying causes, I haven't heard those numbers yet. But be careful, because COVID is indiscriminate. It attacks the young, it attacks old, infants too, and it also doesn't discriminate amongst skin color either. We're going to take a little break. When I get back, I'm going to be sharing a little news from April 11th on the latest numbers in Colorado, which is where I'm residing right now. When I get back, I'm going to be sharing some Colorado news. There was a buzz from Colorado's emergency alert system on April 11th in the morning, extending the stay-home order for 2 more weeks. KUSA Channel 9 on that day reported 383 more cases and 24 more dead, up in the numbers to about 6,900 cases and 274 dead. That is about 4%. New numbers, these latest numbers were announced by Colorado's Public Health. Given testing under criticism and scrutiny, 34,873 people were tested. Put that number over the cases, and if I did the math right, for every 5 tests, one of them is the old maid. And that does it for yesterday's numbers on the coronavirus. I'm pretty sure by now they're going to be getting back to it and giving us an update. But I do hope that you enjoyed my performance. I myself am in no way a doctor, although I would like to be, but I'm not. And the numbers were announced by, Colorado's Public Health, reported by KUSA Channel 9 in Colorado. Well, that does it for this little early morning bonfire. It's almost 7 o'clock here, but I do hope that all of you enjoy your Easter Sunday. For those who have passed, I wish them a peaceful rest.